Welcome to our video on the crucial role of communication in relationships. Effective communication can create strong bonds, while miscommunication often leads to conflicts. In today's virtual world, mastering communication skills is more important than ever. In healthcare, the most common complaint from patients is feeling unheard. This doesn't imply physicians aren't listening, but rather that patients don't feel their concerns are acknowledged. Building trust through active listening is essential in patient-physician relationships. As you've probably found out by now, communication is one of the most important aspects of a relationship. Communication creates relationships. Some of the most important changes in the world happen from how well communication takes place. The end of wars comes from great powers being able to communicate well, and other times poor communication can lead to riots or war. Almost all conflict comes from miscommunication. Miscommunication can happen so easily when you are in person, but it becomes a greater challenge in this world of virtual communication. Active listening is a vital skill that requires practice. By allowing others to express themselves fully and reflecting their words back, you can create a sense of understanding and trust, paving the way for effective communication and education. Active listening is a skill. It is a skill that has been taught over and over again, but it needs continuous practice and training to perfect the art. Once you become good at active listening, no matter what situation and no matter if it is a personal relationship or working with a patient, the person you are interacting with will always know what you are thinking and feeling in the moment. This skill set decreases conflict and confusion when communicating. A common technique for active listening is to first allow the other person to speak, allow them to share their concerns so that you have a good understanding of the person and their situation. Nodding your head not to agree, but to let them know you are listening is important. There will be so many times when you want to interject or correct the person because they could be giving completely wrong information. But allowing that person to have their time is very important when it comes to active listening. After they have time to share, then no matter if you agree or disagree with the information they just said, repeating it back to them can help them understand they're being heard. When someone feels understood or heard, they will be much more willing to take in new information. These are moments when you can start educating the patient. You can help them rephrase or restructure their beliefs without them feeling threatened. This only happens once you've created this trust between you and them.
In personal relationships, trust is a shared responsibility. However, as a physician, you must create a structured and safe environment for patients. This professional approach enhances your effectiveness in providing care and building patient trust.
In personal relationships, creating trust is the responsibility of both people involved in the relationship. Typically, in personal relationships, if one person is highly focused on trying to create security while the other one craves chaos, then the chances of that relationship having success dramatically decrease over time due to this balance.
As a physician, you are considered a professional, so not only are you required to know how to help your patient, but you also are the one in the relationship that is responsible for creating a sense of structure and safety. As a professional, the more you can create this type of environment, the more effective you become in helping the patient.
Being likable is a key aspect of communication. It's about connecting with people from diverse backgrounds and beliefs. For physicians, establishing rapport with patients is crucial, as it often outweighs technical expertise and patient satisfaction.
Another aspect that is important about communication is a very simple aspect of being likable. You can be a very kind person, but to be likable requires an ability to be in almost any situation or relationship, and essential have the ability to quickly make friends, for lack of better words. You are able to talk to anyone, no matter what their race or political beliefs are. You are able to meet them where they are in their life. This is a skill set that is highly valuable to any physician. Before you can become a great physician, you have to establish a relationship with that patient. There are too many times that we hear people speak poorly about their experience with a brilliant physician. Typically, it has nothing to do with the physician's ability, as it is the physician's ability to communicate and connect. The majority of what makes a good physician is not necessarily the education as much as the ability to connect with the patient so that they can utilize that education to help them.
The rise of virtual care demands new communication skills. Without physical presence, conveying empathy and care becomes challenging. Physicians must adapt to ensure patients feel valued and understood, even through screens and digital interactions. A significant change that has happened almost instantaneously is doctoring with no physical contact. There has been a significant increase in virtual care and treatment for patients. This type of patient care is more than likely going to start becoming normal. What does that mean to you? Well, it means that you have to curate and develop new skills to obtain that trust and feeling that you care for the patient. This can be massively difficult when staring at a small screen talking to your patient. There is also going to be a lot more communication through email and text. There will be a lot more sharing of patient information and data without in-person visits. What does that mean for you as a physician? It means that you have to be able to adapt to the current environment to be able to help your patient.
Virtual communication can obscure social cues, making it harder for patients to perceive care and empathy. This can erode trust in the medical profession. Physicians need to find ways to bridge this gap and maintain patient confidence. It is not impossible to make good connections through virtual communication, but it does present its challenges. For example, you can be approaching a patient with the greatest care and empathy, but they cannot sense that care. They may not see all the human cues that show you care. Leaning in, getting down to their level, closeness. These are all social cues that are muddled in a virtual setting. That means even though you're doing an amazing job, care and connection are not being transparent through the virtual connection, and trust is not gained. If this type of scenario continues, then the patient can create a sensation that they're not being cared for, and if they try enough physicians with the same responses, then they start to lose their faith in the whole profession.
To enhance virtual interactions, consider performance classes like theater or improv. These can help you become more engaging on screen, ensuring your communication is clear and impactful, even in a digital setting. Both of these classes can be a fun way to learn to be more engaging when you speak and interact on a screen. If you consider how animated people are when acting in a theater setting, they tend to exaggerate every movement and action so that the person in the back can get a sense of what they are doing. They learn how to be very animated and engaging. They will be having typical conversations that in any other situation could be considered ordinary or even boring. It is the skill of the performer that allows the audience to experience the energy of the performance. The same will apply to you and your interactions with patients on the screen. There will need to be a different type of engagement than what you're probably used to, but it can be paramount to master to connect with patients in this ever-changing world.
Think about how technology can aid in preventing communication disconnects. Personalized messages and open-ended communication can help patients feel heard and cared for even in a virtual environment.
One of the most valuable skills in any profession, especially in medicine, is the ability to communicate clearly and effectively. NeuroChange Solutions helps develop this vital skill by enhancing your awareness of how communication works on a neurological level. In my coaching sessions, we'll focus on improving not only your verbal skills, but also your nonverbal cues, emotional intelligence, and ability to actively listen. Whether it's communicating with patients, colleagues, or teams, mastering this skill will elevate your leadership and effectiveness in any situation. Are you ready to enhance your communication skills and become a more effective leader? Let's work together to build the communication strategies you need for success. Crafting personalized messages is crucial in virtual care. An introductory message tailored to the patient can make them feel valued. Ending with an invitation for further discussion reinforces their importance and fosters trust.
Some simple suggestions for this rapidly changing style of care are learning how to package your information well. As it is important in a personal conversation, it is more important to package your message so that the patient can understand that they are being cared for and heard. This can be done by creating an introductory message that is personal to that patient. It can be a form-written letter with a plug in the blank as long as it is personalized enough that it does not feel like a form letter. Message bots can streamline patient interactions, collecting information efficiently. However, they must be used thoughtfully to avoid frustrating patients. Properly implemented, they can enhance the patient experience by organizing data for better care. The use of message bots can be a great tool or a massive annoyance to your patient. In general, a bot will allow you to collect a specified level of information from the patient without you needing to be present. This can essentially be your intake but is interactive. When using a bot to collect your information, you now have a very organized system of information that you can reference during your visit. Messaging is becoming the preferred communication method for many. It offers convenience and flexibility, allowing patients to engage on their own time. Mastering this form of communication is essential for modern healthcare providers.
physical cues play a significant role in communication. In virtual settings, these cues can be missed, impacting diagnosis and patient interaction. Improving intake forms and utilizing team support can help bridge this gap in virtual consultations.
Accessibility is key in modern healthcare. Social media offers a platform for physicians to educate and engage with patients, addressing common concerns and enhancing communication beyond traditional appointment settings.
Thank you for joining us in exploring the importance of communication in healthcare. By mastering these skills, physicians can build trust, enhance patient care, and navigate the challenges of modern medical practice effectively.